this month on the Living Ladies podcast. Hi, Doctor.
Hi, Amanda.
How are you?
I'm great.
I'm great as well. No complaints. So, the last time we spoke, we covered a vast amount of information on menopause. In terms of treatment, this session is dedicated to HRT. And not wanting to take away from your responses, how about we begin by you sharing with us what is HRT?
Okay, so this is good because I wanted to discuss HRT separate to menopause because this is such a big topic and there are lots of misinformation about it. HRT is actually short for hormone replacement therapy.
What is HRT usually used for?
HRT is commonly prescribed for women with menopausal symptoms. It actually replaces the hormones that your body is no longer producing with menopause.
What are the hormones associated with menopause?
So there are three main hormones: estrogen, progesterone, and testosterone. And yes, women do produce testosterone.
Okay. What are the different types of HRT?
So HRT is prescribed based on an individual situation. If you have your womb, then a combined estrogen and progesterone formulation is used. And the reason for this is estrogen can cause an abnormal thickening of the lining of your womb. And therefore, by adding the progesterone to this, it will prevent risks. It can be given in the form of tablets, patches, or a hormone-containing coil. If you start hormone replacement therapy within 12 months of your menopause, then you are generally given what is called a cyclical combined HRT, and this will give you regular periods. If you start HRT more than 12 months after your menopause, then you are offered what is called continuous combined HRT, and this means you have no periods on this medication. However, in the first 3 months, you may experience some form of bleeding. If you have a hysterectomy, then you will not be given progesterone, but you'll be offered estrogen-only medication. Women who have a low sex drive, perimenopause, or even in the menopause may also be offered a different hormone called testosterone. And this is the hormone that's linked to sex drive in both men and women. Generally, HRT is available in different formulations, such as oral tablets, skin patches, injections, body gels, sprays, vaginal rings, creams, or even pessaries. In Trinidad, currently, we mainly have the oral tablets, some patches, and creams.
So a big question that most women would have is HRT safe?
Yes, HRT is safe, and the effects of HRT have been studied worldwide, and many research centers have been shown that it is effective and safe for women. Initially, about 10 years ago, the studies were done. However, it was slightly biased in a sense. The studies were done on women over the age of 60. And because of some of the side effects over 60 based on age only, the studies were stopped because of the risk of breast cancer and heart attacks. However, when the follow-up studies were done, it was shown to be very safe between the age of 50 and 60. However, this was not publicized as the first set of trials, and this is why women are so confused about HRT. And the new studies have shown that HRT is safe.
What are the benefits of HRT?
There are quite a few benefits, and it's very effective for the treatment of hot flashes and night sweats. Also, low mood associated with menopause. It can also improve sexual desire and reduce vaginal dryness. And very important, it keeps your bones strong and prevent osteoporosis.
What are some of the risks of HRT?
Okay, well, estrogen-only hormone replacement therapy for women who have had a hysterectomy is associated with little or no increased risk of breast cancer. With estrogen and progesterone combination, it can increase your risk of breast cancer. However, this risk is higher the longer you stay on it. And all of the studies have shown that the risk rarely increases after 5 years of using it. This risk is also reduced when you stop the HRT. So your individual risk of developing breast cancer also depends on your underlying risk factors, such as your weight, drinking alcohol, and your smoking habits, as these three all increase the risk of breast cancer. Also, HRT taken as a tablet form increases your risk of developing a blood clot, which is not the case if you use a gel, a patch, or a cream, or HRT in the form of the tablet vaginally. HRT also increases your risk of stroke. However, the overall risk is very low if you are under the age of 60. So once again, you need to discuss your individual risk with your gynecologist to see if it will be safe for you to use.
What makes HRT an unsuitable choice for some women?
Right. So some women who have a family history of breast cancer or who have had breast cancer or even blood clots, this might be a contraindication, but it's not an absolute contraindication because there are different types of breast cancer, such as estrogen positive, estrogen negative types of breast cancer. And remember, we are given estrogen. So if you have an estrogen negative type of breast cancer, then you could possibly use this. Again, it is still an opinion that it has to be discussed on an individual basis. Also, a lot of women ask about whether they can use HRT if they have diabetes or hypertension. HRT itself does not affect your blood sugar control. However, if you are diabetic or have very high blood pressure, you should seek medical advice from your normal gynecologist because HRT can affect your blood pressure, and indirectly, if you have diabetes, you have associated risks with that.
Since memory loss is one of the 34 symptoms of menopause, would taking HRT prevent dementia?
Well, unfortunately, there are no known studies to show whether HRT affects the development of dementia. So we still have to wait on that.
Is contraception still necessary while taking HRT?
Yes, HRT does not provide contraception. And as stated in our last talk, you do need to continue contraception for 1 year after your last period. If this happens before the age of 50, however, you must use contraception for 2 years.
How often should a woman be seen medically after starting HRT?
Well, initially, you should see your doctor after 3 months. And this is because starting HRT within the first 3 months, you can have some irregular bleeding. But after that, then you should be seen yearly. Again, if you have any problems and you're not sure, then seek medical advice before that 1 year.
In terms of usage, how long can a woman use HRT?
Well, there's actually no time limit for how long it can be used. The benefits and risk will have to be weighed, and it depends on your individual situation. However, up to 60, it is generally safe.
Is there anything in closing that you would like to let the listening audience know about HRT? Anything you may want to reiterate?
HRT in itself is generally very safe. It is protective against heart attacks, especially if you have a premature menopause. So women who go into menopause before the age of 51, taking HRT is beneficial. Also, HRT is beneficial lifelong against osteoporosis. So if you have a family history of it, or you do not exercise and you don't take your calcium, then HRT can help to prevent that.
Right. How does a woman stop HRT?
Well, you can either stop it suddenly or more gradual. The chances of your symptoms coming back is exactly the same.
Now, I have four questions here, and they run along the same line, but each for a different symptom. Which treatment is best for hot flashes and night sweats?
Well, HRT is definitely been shown to be beneficial for both of these symptoms.
Which treatment is best for low mood?
Again, HRT is an effective treatment for low mood along with cognitive behavioral therapy. Low mood as a result of menopause is actually different from depression, and antidepressants are not helpful unless you have an underlying diagnosis of depression. If you are on antidepressants, it is also safe to add HRT if you have a low mood.
Which treatment is best for lack of interest in sex?
Again, HRT containing both estrogen and progesterone are helpful for low sexual desire. If this doesn't work, then you may have to consider the other hormone, testosterone, and this hormone has been linked to sex drive in both men and women. This can be given as implants.
And which treatment is best for vaginal dryness?
Well, there are few treatment options. Immediate temporary relief can be used, which would be simple lubricants. Second line treatment would be vaginal moisturizers, and this can be used every 3 days. And lastly, hormone replacement therapy in the form of vaginal tablets, creams, or rings.
How can someone get in contact with your office?
So I work at Southern Medical, and you can call me. By direct numbers are 290-1249 and my assistant 394-7528.
As always, Doctor, thank you for sharing this time with us and contributing to the expanse of our knowledge on women's health, our health.
You're welcome. I look forward to our next chat.
Okay, bye.
Bye.